to the Unitarian Universalists for a Just Economic Community web series. Kris, you please don't mute yourself because we're going to need to hear from you. Our host is Judy Deutsch from New Mexico. Welcome. Our subject is the cost of single payer and how to calculate. Christopher, welcome.
Hi, Kris, do you want to take over from Sally now? We see you, but we can't hear you. So, Sally, do you want to continue before I start?
I don't really have much more to say. This is our monthly web seminar series, and welcome.
And we're interested in a just economic community, and we do whatever we can to inform people about how one might be obtained. And I am a board member of the UUJC, and I've been a member, I believe, since its inception, somewhere in the 80s. Today, however, Sally told us our topic, and it has to do about single-payer healthcare. And our speaker will be Kris Hardy, who's a computer scientist, electronics engineer, and the president of Albuquerque Software. He's a graduate of the United States Air Force Academy, an Air Force veteran, and a member of Veterans for Peace. Some of Kris's recent work includes the Medicare for All calculator, which Kris will tell you about in a little while. Hacking voting machines to improve their security. Researching the hack of the 2016 Democratic National Committee. Building machine learning and artificial intelligence systems for clients, and teaching IT and cybersecurity for Central New Mexico Community College. Kris certainly comes to us with a load of experience. And now, Kris, please take over.
Thank you, Judy. I very much appreciate it. First question, can everyone hear me okay?
Yes.
Okay, I got a thumbs up, I got a yes, I have 2 yeses.
Yes.
Okay. 3, okay, so that's a quorum, we'll take that. So thank you first off for allowing me to talk about the Medicare for All calculator, and especially a huge shout out to UUJEC for giving us the grant to continue this research. I think it's a really important project, and I'm really happy to talk about it today. So the way it started is Herb Hoffman and I were both involved in Veterans for Peace, and he and the Progressive Democrats for America, the Central New Mexico chapter, I guess it is, had this idea of putting together a calculator that would allow people to input their income and their current Medicare their current medical expenses, and be able to determine whether or not they would, an individual would save money or end up spending more money under a Medicare for All plan. So Herb came to me and I said, yeah, I can do that. So we worked together, and so what I'm going to show you is, let me see if I can take over the screen here. Give me 1 second. And let's do this, share that screen. And hopefully, I still see my face. Let's see, make sure.
That's okay. We see your screen.
Okay. Do you see the Medicare for All calculator website?
I did. Now I see a window in your computer.
Okay, let me close that out. Let me figure out how to do the sharing thing.
There it is.
Okay. Let me make sure everyone can see it okay. So this is the first time I have used this system. So I was expecting to have a little screen or something showing up. It's hard because I can't see what you guys see. So.
Well, we see what says Medicare for All calculator on the top. How much money could you and your family, etc. And then it says use approximate values below.
Okay.
And there are the, should
Okay.
I tell you what's below?
No. I think I got it. Okay, so the thing I'm hoping. Can you see the calculate button down at the bottom?
Yes.
Okay, good. That's what the important thing. Okay. So this is the Medicare for All calculator that we ended up building, and it's at www.mfacalc.com. That's mfacalc.com. And it's intended to be a really simple site that anyone can go to, and they just have to fill out 5 fields, and it will calculate how much that they will save or have to spend. Oh, there's a screen. How much they can save or will have to spend in addition under Medicare for All. So let me put in some figures real quick to show you just how it is. The first question is, including yourself, how many people in your family are covered by your insurance policy? Let's say you have 2 people in your family. Then you fill out the next field, that is your annual wages, salaries, and tips income from last year's IRS 1040. You can click on this help link, and it will tell you where on the 1040 to look it up, depending on which form 1040 you filed. Let's say that I made $40,000 last year. So I'll put that in my wages. The next field is your annual additional taxable income. This is things like business income, interest, dividends, other things that wouldn't come on a W-2, for example. Most people are not going to have much, so let's put 0 there. And now we'll put in our current medical expenses. So the annual premiums for health insurance, vision, and dental. Here in New Mexico, for a family of 2, if both individuals are about 40 years old, the numbers come out to around $800 a month, or let's say that's going to be $8,000, $16,000 a year. Is that right? 800? That's not right. That's let's see. That's going to be 8,000 plus another 16, so 9,600. And then finally, your annual out-of-pocket medical expenses. And let's say I have all my receipts, and I spend $1,000 in medical expenses. Let's say if I can click calculate, it's going to take all those numbers and run a calculation on them and compare how much you spent last year to how much you would pay under Medicare for All based off of your income and your W-2 income, as well as any interest, dividends, and unearned income. And so based off those numbers, we see that I should save about $9,400 per year under Medicare for All. So before I go into how this works and where these numbers come from, does anyone have any questions there? No? Okay. So let's go really quickly. I'll go back to the form once more and show you one more final detail. If, for example, some people, as they're going through the calculator, you may not know what exactly is covered under medical expenses or not. So I do have some help fields here. So if you hover over the help field or click on it, it'll show you what values to enter. Or you can click on this worksheet, And this will bring up all the different categories, in this case, of your premiums, your health insurance premiums. So the first field is your total health insurance premiums. The next one are any payroll deductions, to make sure you consider those, because under Medicare for All, you wouldn't have a payroll deduction for healthcare. Total employer's benefits, your total dental insurance premiums, vision insurance, or long-term care insurance. So we have a worksheet for the premium side of the equation, as well as under the medical costs, out-of-pocket medical costs. You click on that, there's another worksheet that breaks down all the different categories of out-of-pocket medical costs that would be covered under a Medicare for All plan, as it's written in House Resolution 676. So you can fill out these numbers, let's say 100, 400, just throw some examples, and then click Save, and you can see that the out-of-pocket medical costs was the sum of everything they entered. So it's another way for people to enter their values. Okay, so let's talk about where these numbers come from, because that's the really important thing. Now, let me run this calculation again. What I say? Let's put 1,200 there, and let's say 1,000 medical costs. Okay. So we have a big number here of $11,800. Pretty large number. Let's see if we can figure out where that came from. All of these calculations are based off an analysis that was done by Dr. Gerald Friedman at the University of Massachusetts Amherst. Let me see if I can bring up that report that he put together. Before I go on too longer, Judy, how long do I have, or how much time should I spend?
I believe it's an hour altogether.
Oh, okay.
Really?
Well, I sure hope I won't have to take that hour, but I'll go through everything that I have, and then open up for questions and let you guys fire away. So can everyone see the PDF I just opened that's called Funding HR 676, the Expanded and Improved Medicare for All Act?
Yes.
Okay,
Yes.
Excellent. Yeah, this thing didn't quite share in the way that I was intending. Oh, I see what happened. Let's see. I'll do this. Okay, can everyone still see it?
Yes.
Okay, good. Okay, so this is the analysis that was done by Dr. Gerald Friedman to try to figure out how a Medicare for All plan could be funded. If you guys are familiar with House Resolution 676, I can't remember who's leading the charge on that now. I know it was Keith Ellison.
I believe it's still Ellison.
Okay.
It had been John Conyers.
Oh, John Conyers, yes.
Conyers for years.
Yeah. So House Resolution 676 doesn't provide any. It doesn't have any language in it to talk about how the bill or how Medicare for All will be funded. It talks. It mentions that current funding sources that are being allocated for Medicare. I presume Medicaid. The current federal sources would be rolled over to Medicare for All, but there's no description of any increase in taxes or anything else about how it's going to be funded. So the best numbers that we have right now are coming from industry analysis or what's the right term I want to use? Analysis for an economics analysis to try to figure this out. And I know that there have been more recent analyses that have been done. One quite recently that I heard of that was funded by the Koch brothers. I haven't had a chance to look at that yet to see how that plays with everything else. So everything we have right now is based off of Dr. Friedman's analysis.
Let me interrupt to say that I haven't read that report yet, but I've read a summary of it. And the Koch brothers report, I think accidentally, shows that money would be saved with single pay.
Yes, that's my understanding as well. Yeah.
Yes.
What we have right now is using Dr. Geraldman's, Dr. Friedman's analysis. If we go to page 3 of it, in the executive summary, with his analysis, going to a Medicare for all system would save the U.S. about $600 billion per year. A lot of that is due to decreasing administrative waste, taking advantage of being able to negotiate pharmaceutical prices, dealing with some economies of scale you can have because you have a larger system. So under Medicare for All, a big driver for it is it's both going to save most people money, as well as save the government as a whole, or our economy as a whole, about $600 billion. Specifically, the way that Dr. Friedman plans or has suggested paying for Medicare for All is sort of a group of tax increases. It's all sort of underpinned by maintaining the current federal financing for healthcare and then just rolling that over into the Medicare for All system. And then the tax increase would be done in a progressive taxation manner. And so what we are primarily looking at is, we look at the bottom 2 ones here. Depending upon the income of the individual, if the individual makes $53,000 or less per year, there will be a 3% payroll tax on that earned income, on that W-2 wage income. If they make more than $53,000 per year, there will be a 6% tax. So if you make less than $53,000, it's a 3% tax. More than $53,000 a year, it's a 6% tax increase. If an individual, if you have any unearned income, so business income, capital gains, dividend taxes, rent income, etc., there will be a 6% tax on all of that unearned income, regardless of your total earned income. For individuals that have a very high income, and this is incomes over $225,000 per year, there is a 6% high income surtax. So that's a 6% tax that's applied to the tax that is levied on that individual. So it's going to be the income. It's take the income tax that they pay, apply a 6% tax on that income tax, and that would be the high income surtax. And then finally, it's less significant. I don't have it in the calculator. There is a 0.5% tax on stock trades, or 0.01% tax per year on all transactions in bonds, swaps, and stock trades. So based off those numbers, we go down to, I think it's page 8 of this report. Dr. Friedman has a chart that he put together of what making some reasonable assumptions of income and how the income is distributed. Who is going to save money under Medicare for All, and who's going to have to pay more under Medicare for All. And so Dr. Friedman's analysis is that the break-even point is somewhere between $216,000 and $262,000 a year. Any individuals that are making between that amount are probably going to, it's probably going to be a wash for them. They're not going to pay more. They're not going to save anything. Anybody who's making less than probably about $220,000 a year is going to save under a Medicare for All system. And anyone who's making over that, over $220,000 a year, is likely going to pay more under a Medicare for All system. So what this chart is basically telling you, that this break even is somewhere around $460,000, I'm sorry. But most people, the vast majority of people, basically anyone who's not in the 1%, is going to save under a Medicare for All system. So using those calculations that Dr. Friedman put together, those calculations are what are driving this calculator. So based off of your earned income, your additional taxable income, so this would be the things that are subjected to that 6% unearned income tax, and then your current insurance premiums, your current out-of-pocket expenses. That allows us to calculate what the healthcare situation looks like for you today, and then based off of your income and your unearned income, what your healthcare expenses would likely look like if we went to Medicare for All. Let's take one quick example. Let's do an example with somebody who has much higher health insurance premiums, maybe much higher income, just to see how things pan out. So let's say that my annual wages were, let's say, $200,000 a year, and annual taxable income or additional taxable income, let's say that's $100,000 per year, and insurance premiums, since these aren't, your current insurance premiums aren't really related to your income, these usually aren't going to increase by much, except that maybe you have a more expensive plan. So let's say you're paying $1,000 a month instead of $800 a month, so $12,000 a year. And then out-of-pocket expenses, let's say it's $5,000. We do calculation on that. You can see even that individual who's making about $3,000 a year would have an increase or have a savings of $5,000 a year. Okay. But finally, let's go back to.
Somebody has asked if we could have the calculator back on the screen.
Oh, it's not back on the screen? I'm sorry.
I'm looking at the PDF, yeah.
Oh, aha. Okay, so I got the sharing working right and then flipped. Let's try this. Boom. Share. Should be back up now.
Yep.
Excellent. Excellent. Okay. So to go through this again, we have let's increase an individual's income closer to that point where they might have to start paying some. So we'll have usually an annual income of $200,000, additional income of $100,000, so a total income of $300,000. We are going to say that their insurance premiums for their family is $12,000 a year, and out-of-pocket medical expenses of $5,000 a year. Calculate, and we can see that their estimated savings they're still going to save some money of $5,000 a year. So let's go back and let's create a situation where we know that they're going to have to pay some more. Since the unearned income, so not wage income, the unearned income of rents and investments, since that's taxed at 6%, let's go ahead and let's say this individual makes a lot of money in investments. No calculation now. We can see that the results, how it's laid out, has changed a little bit. Rather than showing, in the previous calculation you saw, this is how much you're going to save as big bold letters. In this case, the individual is going to pay more, so they're going to save $17,000 that they won't have to pay in healthcare expenses. However, their taxes are going to increase by $36,000. I want to show this to them, but I don't want to really bring attention to that, because in my view, in that case, the really important thing is that their healthcare insurance under Medicare for All is not tied to their employment. It's the fact that they're paying taxes means that they are covered under a healthcare system, or the fact that they're a U.S. Resident means that they're covered under Medicare for All. So the really important thing is that if they lose their employment, they're not going to lose their healthcare coverage. I have a couple other notes for them that we all know healthcare expenses and insurance premiums are increasing year over year. Under Medicare for All, that is not going to be the case because we don't have a private insurance system that is increasing healthcare expenses. or help increasing premiums each year. And as a business owner, one issue that's really important for me is with any employees I have, how are they going to be covered? Right now, businesses are, it's very difficult especially for small businesses right now, because healthcare premiums have been increasing dramatically. And under Medicare for All, the government is going to take over everyone's healthcare under Medicare for All. So companies don't have to provide health insurance for employees anymore. So that's something that business owners don't have to worry about, which is another benefit. So finally, the bottom of this results field is if the individual is going to save money under Medicare for All, or they're going to spend more, the call to action is still the same. We're asking that they call their congressmen, call their representatives, and ask them to support Medicare for All. Also, I'll go through this in a second. I do have an email list that we're going to be attaching to this this calculator, so that people can, if they want to see what's happening with the fight for Medicare for All and stay engaged and know when they should do something, they can sign up for that mailing list. It's not yet active, but that will be coming. Finally, we have a phone number for the Capitol switchboard, so that individuals can call their congresspeople and say that, ask them, call them and ask their office to support Medicare for All. Underneath the calculation results, we went through a bunch of videos to try to find the best one that was a good explainer for what Medicare for All is. There is, we found a couple, but this one that's posted on YouTube for Bernie Sanders, an explainer that talks about Bernie Sanders' plan. It's not necessarily 676. Let me pause that for a second. It's focused specifically on Bernie Sanders, but it seemed to be a really good overall view of what is Medicare for All. It doesn't necessarily go into House Resolution 676 or Senate Bill 1804, which is the Senate's version of the Medicare for All Act. But it is a good overall view. So hopefully people will watch that and will learn some about what Medicare for All is. And finally, down below the video, this is where this is right now, we're probably going to move it, but right now this is where the subscription form for the email list is likely going to be put when we make that